right. Hello, afternoon, and welcome to today's fireside chat in honor of Awareness Month. I'm Amna Hussein, the Community Outreach and Engagement Manager at the Masonic Cancer Center at the University of Minnesota, and I'm honored to be your moderator for today's fireside chat. So the fireside chats are brought to you by the Office of Community Outreach and Engagement at the Masonic Cancer Center at the University of Minnesota. The Office of Community Outreach and Engagement serves as a vital bridge between the Cancer Center and communities across the state of Minnesota and beyond. Our dedicated team is committed to reducing the burden of cancer by actively engaging communities and providing access to relevant knowledge on the latest in cancer research, prevention strategies, the importance of screening and early detection, treatment options, survivorship, and opportunities for clinical research. Today's fireside chat will focus on lung cancer, a disease that remains the leading cause of cancer deaths worldwide, surpassing deaths from breast, colon, and prostate cancers combined. While smoking is often considered the primary risk factor, it's important to recognize that lung cancer significantly impacts non-smokers as well. As you'll hear Dr. Begnaud put it, anyone with lungs can get lung cancer, which highlights the importance of understanding all risk factors associated with this disease. So to provide deeper insight and to shed light on these risk factors, we are honored to have two distinguished experts with us today. First, we'll hear from Dr. Abbie Begnaud. Dr. Begnaud is a Louisiana native who joined the University of Minnesota faculty in 2013. Dr. Begnaud has an interest in the diagnosis and treatment of lung cancer. As an inaugural diplomat of the American Association of Bronchology and Interventional Pulmonology, she is trained in advanced diagnostic and therapeutic procedures, as well as general pulmonology and critical care medicine. She collaborated to launch the University of Minnesota Lung Cancer Screening Program and continues to oversee all of its activities. Dr. Begnaud's research interests include implementation and dissemination of lung cancer screening and use of lung cancer screening to reduce health disparities seen in lung cancer. She is currently studying how incidental findings of lung cancer screening impact the overall benefit of this health service. Following Dr. Begnaud, we'll hear from Dan Tranter, who is the supervisor of the indoor air unit at the Minnesota Department of Health. Dan has been with the department since 2001 and holds a master's degree of public health from the University of Minnesota. His work involves research, education, and outreach regarding indoor air quality, focusing on radon, mold, and carbon monoxide. Dan's team also regulates smoking in public places and manages professional licensure for radon professionals. His expertise will shed light on how environmental risk factors, particularly radon, contribute to lung cancer. So as you heard, our experts today bring such a wealth of knowledge and expertise, and we are so fortunate that they are joining this important conversation today. Their unique expertise from the clinical practices and public health outreach will provide a comprehensive understanding of lung cancer risk factors and steps we can all take to actively address them. So before we begin, I'll just cover a few quick housekeeping items. Today's fireside chat is recorded, as they always are, and we'll post the recording on the Masonic Cancer Center's YouTube page. For all University of Minnesota employees and spouses participating in the university's Employee Wellbeing Program, you can earn your 2 wellbeing points by completing the form that will be linked in the chat shortly. And during the session today and throughout the presentations, please use the Q&A feature at the bottom of your Zoom screen to submit any questions or comments that you have. We have time carved out at the end for a Q&A session with our speakers. So without further ado, I will now pass it over to Dr. Abbie Begnaud. The floor is all yours.
Thank you, Amna. I am excited to be talking with you today. I have a lot of things I want to talk about. I tend to talk fast, so I will try to leave some time for us to have a discussion, really, and so share some information then and have us talking. I am also sitting by my own fireplace today, but for reasons that we'll get into later, the fire is not lit. This is just a really brief overview. I know we may have many people who know this and maybe some people who don't, but just to kind of understand, why does cancer happen? How does it happen? You know, it's really all about your genes. And so genetics can include inherited genetic issues from your family. And also there can be mutations that can happen through your life through things that you're exposed to. So this little infographic shows a few different types of exposures to things that can lead to genetic mutations that can develop into cancer. I like to think of it more like genes or recipes. So here's a picture of the genetic code and the gene signatures that are turned into proteins in our body. That's very complicated, but I think of it like this, like a recipe. So here's an example of a recipe, right? The recipe is what tells you what's supposed to happen, but then you have to do things. You have to gather ingredients. You have to put them together in a certain way. And there are a lot of ways that the recipe can go awry. I'm someone who is not the most skilled baker, so I've had lots of experiences with recipes going awry in one way or another. So understanding cancer using this baking analogy, you might think of hereditary or inherited genetic problems might be a bad recipe. You miscopied the recipe from your grandmother's cookbook, or a page got missing, and so you have the wrong instructions to begin with. Whereas some of these other factors or exposures, you might think of them as, you accidentally put spoiled ingredients, your milk had gone bad, or maybe your oven temperature was off, or maybe you're at a high altitude and you didn't use the appropriate modifications to make the recipe go through correctly. So there are a lot of different ways that things can go off track and turn into cancer. So what we're going to talk a little bit about today, of course, as Amna said, is lung cancer and some of the things besides cigarette smoking that can cause you to go off track and develop lung cancer. In Minnesota, the risk of developing lung cancer throughout the life of a Minnesotan is about 1 in 16 or 1 in 17. It's 1 in 17 for women, 1 in 16 for men, so slightly higher risk for men. And in the last, in these years between 2014 and 2018, there were 18,000 new cases of lung cancer diagnosed in Minnesota. And in that same time period, nearly 12,000 people died from lung cancer in Minnesota. As you said, who can get lung cancer? Anyone with lungs. Risk factors include exposure to a variety of inhaled materials, different types of smokes, different types of particles, radon, which Mr. Tranter is going to talk to us about, air pollution. Family history is another really important risk factor that we'll talk a little bit about today. And lung cancer in some ways disproportionately impacts people who are from racial and ethnic minoritized groups, as well as people employed in manual labor occupations. And I'm going to talk about that too. So Minnesotans with lung cancer, who in Minnesota is getting lung cancer? Incidence on the top describes the number of new cases of lung cancer in Minnesota. Mortality on the bottom describes the number of deaths from lung cancer. So these are age-adjusted rates per 100,000. So of course, there's more than 100,000 Minnesotans, but for every 100,000 Minnesotans, you might see 123 Alaska Native or American Indian Minnesotans develop lung cancer. So you can see here that the largest burden of lung cancer in Minnesota is borne by our Alaska Native and American Indian residents, second to our Black Minnesotans, and then the third group is the white Minnesotans for both incidence and mortality. However, as Amna mentioned, not everybody who gets lung cancer has smoked cigarettes. There's a pretty widespread, I think, misconception that most people or all people who get lung cancer smoke cigarettes. So this was a study that was published a few years ago in the Journal of the American Medical Association, which is a very well-respected journal, looking at 7 states who had cancer registries, which allowed them to determine this kind of information. And of these states in the 2000s, 12% of the people diagnosed with lung cancer had never smoked cigarettes. So that's probably larger than most people are thinking. You can see here, these numbers that I have circled are also another 50% of those are people who had previously smoked. And so most people who get lung cancer are not currently smoking cigarettes. These groups are broken down by age and by race and by sex. So on the left side of the screen, we're looking at women. On the right side of the screen over here, we're looking at men, and they break down by age and by race. And I want to point out that this never smoking lung cancer varies quite a bit by race. So in women, up to almost 60% of women who identify as Asian and Pacific Islander may never have smoked who have lung cancer. 30% of Hispanic women with lung cancer, and even in the lowest group in white women, it's still 13%. So again, you absolutely do not have to smoke to develop lung cancer. In that table, they showed who was a quote unquote never smoker. So I just thought it was important to show you the definition that researchers typically describe as a never smoker is an individual who has smoked less than 100 cigarettes in their lifetime. So there's usually 20 cigarettes in a pack. So less than 5 cigarettes, less than 5 packages of cigarettes in their whole lifetime. So somebody who experimented a few times in high school or college would still be considered someone who had never smoked. There are other definitions and other types of studies where they put that threshold at a little bit higher than 100 cigarettes, but essentially having a few cigarettes doesn't mean you're a never smoker. This is how researchers describe who is a never smoker for these studies. So again, cigarette smoking is a very important and the #1 risk factor for developing lung cancer, but there are many, many other important ones. So I'm not going to talk too much about cigarette smoking. A short answer, if you remember anything, is that burning stuff and inhaling it is not good, which is why I'm not actually lighting my fire today. I have an electric heater on here to keep me cozy for our little chat. So here's a picture of, house fires, cigarette fires, wildfires, cooking fires, campfires, and fireplaces. All of these fires put off potentially toxic materials and carcinogens that can lead to cancer. So of course, personally smoking cigarettes, tobacco cigarettes is an important exposure that contributes to lung cancer. Secondhand tobacco smoke or passive smoking is another important one. Other environmental smokes, like I just mentioned, smoking things besides cigarettes. I know lots of people wonder about things like hookah and marijuana and e-cigarettes, and we'll talk about that. Occupational and industrial exposures, so things that people are exposed to either by virtue of the job that they have where they work or potentially where they live, if they live in an area that has industrial factories and pollutants. Exposure to pollution is something that all of us are susceptible to in some degree. And then again, radon exposure, which Mr. Tranter is going to talk about. And lung inflammation is also potentially a contributor to lung cancer. So chronic lung disease that leads to increased inflammation in the lung may also contribute to increased risk of developing lung cancer. So there are a few different types of lung cancer, and our focus really here today is not on about the diagnosis or the treatment of lung cancer, but the one thing I want to point out is that this colored pie chart on the left demonstrates a variety of different genetic mutations that can be found in certain types of lung cancer. And so each of these genetic mutations can be associated with sometimes different specific risk factors. For example, over here on the left, KRAS is one that has been known for a long time to be much more likely to be associated with cigarette smoking. This one over here, EGFR, is a type of genetic mutation in a cancer that has long been known to be associated with people who do not smoke, especially the classic example of a person with an EGFR mutation lung cancer would be a non-smoking, never smoking Asian woman. And it's pretty exciting in lung cancer. In the last few years, we have some science that helps us understand how that happens. So this science was done and was published in the United Kingdom, and they looked at PM 2.5. PM 2.5 is particulate matter that is 2.5 microns or smaller in diameter. So this little graphic shows you how small that is. Basically, 5 PM 2.5 particles lined up next to each other would be the size of a PM10, and 5 of those would be the size of a human hair. So this is incredibly small, fine particulate matter that you really cannot see with your eye, many, many times smaller than even a grain of sand here, as it's showing. And repeated inhalation of this pollution and this particulate matter can lead to inflammation in the lungs. This inflammation wakes up these normally inactive cells, which can lead to cancer-causing mutations. And so in this study, they found that excessive exposure to pollution led to EGFR specific lung cancer. So this is a really important link in the mechanism of what we had figured out clinically, but understanding how that happens. Secondhand or passive smoke exposure, it's clear that this is involuntary smoking is how the International Agency for Research on Cancer describes it. It's clear that it's carcinogenic to humans with an increased risk of 20 to 30% for people who never smoked, but who maybe live in the home with someone who smokes. And there's a very consistent, what we call a dose-response relationship. So the more secondhand or passive smoke exposure, the greater the risk for a person who's exposed to it. And these are more likely to cause the types of cancers that are related to cigarette smoking. Here they have a squamous cell and small cell. So this is an example of that dose response relationship. So these columns, active smoking. So this is a person who smokes cigarettes themselves, and then exposed to secondhand smoke. So this is an observational study where they looked at people who smoked cigarettes, people who were exposed to secondhand smoke at home or at work, and some people who did both. So for example, on the top line, you see people who never smoked themselves, people who were never exposed to secondhand smoke, how many people were in each group. The cases would be the group of people who got lung cancer, the controls, or the group of people who didn't get lung cancer, and then the odds ratio. So this group of people who were never exposed to smoke is the reference group. And then when we compare to them, people who never themselves smoked cigarettes, but were exposed to secondhand smoke, had an increased risk of developing lung cancer. So their odds ratio is 1.24. So that's about that 24% increase. Now you can see here on the next line, just to give you an example of how that compares to actually smoking. For someone who actually smoked, so that's ever under active smoking over here, but never was exposed to secondhand smoke, those people had a 3.7, almost 4 times risk of developing lung cancer. So many orders of magnitude higher risk of smoking yourself, but passive exposure does slightly increase the risk. And then the bottom number is the group of people who both also smoked themselves, but were also exposed to secondhand smoke and had nearly 5 times the risk of developing lung cancer. So this is just to kind of give you an idea of the relative contribution of actually smoking yourself versus being passively exposed to smoke, and how those contribute variably to an individual person's lung cancer risk. What about smoking other stuff? I get these questions a lot lately. These things are increasingly popular. The short answer is I don't really know. Researchers don't really know, I think. When it comes to hookah smoking, maybe, probably. Marijuana, probably, maybe. Definitely yes, maybe. All of these smokes contain many of the same toxins and carcinogens as cigarette smoke: carbon monoxide, ammonia, all of these chemicals. And so it's certainly plausible that they do, but they haven't been studied and haven't been around in a way that we can develop as clear of a relationship. So hookah smoking is a water pipe. Here's a picture of a hookah. Some people might think that that the water filters out smoke and toxins. That is a misconception. Many people who smoke hookah do not do it in the same way that people smoke cigarettes in terms of the regularity and the frequency. However, a person smoking a hookah for 1 hour is getting exposed to the same amount of smoke as 1 to 200 cigarettes. So it's a much more intense exposure to smoke, even though the typical behavior is very different. In addition, the charcoal that might be used to heat hookah can also produce carbon monoxide and other metals. So one study showed that there was maybe a twice the odds ratio of developing lung cancer in people who did water pipe tobacco smoking. Similarly, with marijuana smoking, the data are really mixed. Marijuana smoking has been around for a long time, but it hasn't been all that thoroughly studied in the US. In 2018, the National Academies of Science concluded that there was moderate evidence of no statistical association between cannabis smoking and lung cancer incidence. However, this is another ratio chart here showing people who never smoked cannabis to people who ever smoked cannabis, and that there was a higher hazard ratio of developing lung cancer. This is whether or not they smoke cigarettes. This was everybody included, because many people who smoke marijuana also smoke cigarettes. However, there was another pretty well done study in young Swedish males who were drafted into their military service in 1970. And again, they saw a 2 times risk of lung cancer over the following 40-year period for people who reported heavy cannabis smoking, which they described as at least 50 times over their life. So hard to say for sure, but I think probably yes, they do contribute. What about vaping and e-cigarettes? That's an even more tricky question to answer. Hypothetically, we expect that e-cigarettes will be less carcinogenic than combusted tobacco because you don't have all of those toxins in the smoke. But uncertainty about it really remains. I mean, these are relatively new. All of these studies that showed that lung cancer was caused by cigarette smoking took decades to have that kind of data and time frame. This is a comparison of some of the, a couple of chemicals, formaldehyde and acrolein levels in a cigarette smoke and an e-cigarette aerosol, about 15 puffs, so presumably an equivalent amount. So you can see that the ratio of cigarettes to e-cigarettes is 9 for formaldehyde, 47 for acrolein. So we think probably e-cigarettes are less harmful from a lung cancer perspective than smoking tobacco cigarettes, but it's really unclear at this time. Indoor emissions, so this is also smoke. Fuel combusted in the home for heating and for cooking also puts off harmful chemicals that can lead to lung cancer. So this chart here is looking at coal use in Asia. So apparently coal is a more typical use thing that's burned for fuel and combustion in Asia. And you can see here very high levels, an odd ratio of 5. So 5 times the level of developing lung cancer. Whereas more solid fuels like wood and like natural gas would be slight increase in risk. Beyond this line is a slight increase in risk of developing lung cancer, but not quite as significant as coal burning. Occupational industrial exposures, there are quite a few. I'll point out just a couple, but many chemicals as well as smokes that people can be exposed to through their line of work can be increase the risk of lung cancer. Arsenic, beryllium, air pollution, so diesel exhaust. Think about people who work in garages, people who work in places where there are idling vehicles, people who work in areas where there's high traffic and pollution. Power plants, large list of things here. And if you're interested in learning more about it, you can probably look through the slides and see it, aircraft and aerospace injuries, mechanics, firefighters, road paving, construction, photography, granite and stone industries, professional drivers, all of these are potentially hazardous from a lung cancer perspective. So again, the short answer is burning stuff and inhaling it is not good for your lungs, no matter what you're burning. Family history is also really important. This one is one that we don't understand all that well. There are other cancers where we really have a clear idea of how they are genetically linked and how they are inherited, but a lot less is known about lung cancer. It's probably a bit more complex, maybe because of those shared environmental factors, right? You grow up in a home with radon, you grow up in a home with smokers. But studies have indicated that if you have a family history of lung cancer in a sibling, you're probably 2 to 3 more times likely to have lung cancer than somebody who doesn't. So family history is something really important to pay attention to, especially if the person in your family is someone who did not smoke cigarettes very heavily. So at this point, you might be thinking, what about me? How can I estimate my own risk for lung cancer? So here's a website. This is based out of Canada that you can put information in about yourself. This is the most comprehensive one that I have seen with regard to other environmental exposures. So the website's down here on the bottom. If you know how to use a QR code, you can point your phone at this as well. And you go through and take a short quiz and get some information about your own risk for lung cancer. So I want to briefly talk about lung cancer screening because that sort of gets to where we are here, which is that in any time you're doing a screening test, a cancer screening test, the goal is to find a cancer early and reduce the chance that someone who got screened will die from that cancer. So the screening test needs to have more potential benefits than harms for these group of people. There are a lot of different potential harms of screening tests, whether it's a complication from the test itself, an inaccurate test result, but overall, the purpose of screening is to save lives. And so right now, this is the group of people who are recommended to receive screening for lung cancer, which is with a low-dose CT scan of the chest. People who are aged 50 to 80 who have smoked cigarettes for a long time, the equivalent of a pack a day for 20 years or more. And again, this is based on large clinical trials that prove that lung cancer deaths are reduced by doing an annual CT scan in this group. I bring this up to say that when I have these conversations with people, you're here, you're concerned about it. I have convinced you that smoking is not the only risk factor for lung cancer. And then I have to tell you that you really can't be screened for lung cancer right now because you're not high enough risk that we are aware of to be screened, and it doesn't quite make sense. So that's something I'm happy to talk through with the audience. And so, in summary, how to reduce lung cancer deaths, early detection and screening when finding cancer, when there's a better chance of cure and it's more treatable. We also have better treatments available for lung cancer now. And then we want to ultimately reduce cancer rates by avoiding smoke exposure, avoiding radon exposure, and minimizing our exposure to pollution. So what to do if you're at risk, but you're not eligible for screening? If you do one of these risk tests, or you know from your family history that you're at risk for cigarette smoking, it's important to be aware of your body and to pay attention to your body. If you develop symptoms, cough, like chest discomfort, difficulty breathing, you should definitely seek attention for those and advocate for yourself, because there are many healthcare providers who still wrongly believe that only people who smoked a lot get lung cancer. So early detection, which is identifying a problem as soon as it's obvious, is not the same thing as screening. And screening is only recommended right now for older adults who have smoked cigarettes for a long time. So this is my final slide. I'll turn it over to Mr. Tranter, and then I'll be happy to answer questions afterwards. Should I stop sharing now?
You can stop sharing now. Thank you, Dr. Begnaud.
Good afternoon. I'm Dan Tranter with the Minnesota Department of Health. Thanks for having me. Appreciate being here to talk about radon. As you heard, radon is a known lung carcinogen. The good news is this is a risk that we can address by testing our homes, and if the results come back high, we can fix our homes. Here's my contact information, my phone number and email. You're welcome to call me or email me with any follow-up questions about radon. We also work with a lot of different organizations to raise awareness, do education, and to increase testing in our state. So I welcome your questions and ideas for partnering together to increase radon testing. So radon is a type of radiation. It's a
Dan,
gas.
I'm sorry. Are you sharing slides? We don't see anything. Are you trying to share?
Oh, I thought I was sharing. Let me try that again. Are you
There
able
you
to
go.
see my slides?
Yeah.
Very good. Okay, sorry about that.
It's just not in presenter mode right now. Change it to presenter view.
Let me try again.
It's that little icon that looks like a pull down projection slide.
Does that look good?
We don't
Well, we're
see
not
them.
seeing anything now.
You gotta go back in Zoom. Are you able to see it?
Yes, I think if you click that little, when you're in there, that little presentation button, it'll just go into the slide presentation mode.
And try it like this.
Perfect.
Are you able to see it? We're good?
Yeah.
Yep.
All right, sorry about that.
Thank you.
So it's a type of radiation. It's naturally found in our soil, and it comes from uranium. We have quite a bit of uranium in our soil. That uranium breaks down and it becomes a gas. The gas is called radon, and it floats around the soil. It comes up to the top of the soil. It gets released into the outdoor air. Some of the radon gets sucked up into our homes. It can build up to high concentrations. We can't see or smell or taste it. The only way to know if you have a radon problem is to test your home. And as you heard, it is a known lung carcinogen. It's probably the second leading cause of lung cancer overall, and the leading cause of lung cancer in never smokers. As I mentioned, it comes from the soil. That's the main source. We don't see much in our drinking water, so we're not too concerned about radon in Minnesota's drinking water. Our municipal drinking water systems do test for radioisotopes to verify levels are low. If you're on your own private well, you're responsible for your water. You could test your own private well if you really wanted to, but it's unlikely to be high. So our main concern is the air that we breathe, and in particular, the air inside our homes and other buildings where radon can build up. So the EPA has done a risk assessment on radon, and it's a little dated, I'll admit. So I'm not sure what the numbers would be today. It could be a little higher or lower, but they had estimated about 21,000 lung cancer deaths annually are caused by radon exposure. This includes both smokers and never smokers. So most of the radon deaths are actually caused in smokers because smoking and radon have like a multiplier effect, making it much worse than each individual risk. But there are also thousands of lung cancer deaths attributed to radon in people who've never smoked. In Minnesota, overall, it's estimated about 600 lung cancer deaths are attributed to radon annually, which is high relative to our population. So we can measure radon, and it's measured in units called picocuries per liter of air. So PCI stands for picocuries. Those are units of radiation. And we can measure it in about a liter of air, so a little bit more than a quart. And what you see here are some numbers that are relevant for us. Outdoors, the radon levels are about 0.4, 0.5. So we can never completely eliminate radon from our lives. The indoor US average is about 1.3. And at 2.0, we recommend people might consider fixing their house. At 4.0, we highly recommend it. And the average level indoors in Minnesota is about 4.2. So we have very high levels in Minnesota. About 2 in 5 Minnesota homes that haven't been tested, which is most homes, have high radon. Now, this doesn't include the small number of homes that have been tested and fixed. So overall, we see about 40% of homes are high for radon in our state. And across the state, southern and western Minnesota homes have higher radon levels. We have counties where 65 to 80% of homes have tested high. In northern Minnesota, that's shown in green in this map, it is relatively lower than southern and western Minnesota due to geological differences. But even our lowest county, there's 16% of homes have tested high, which is very high prevalence for an environmental hazard. And it comes in through the foundations of our homes and buildings. You might think your house just brings air in through walls and around windows, but in fact, there's air coming in through the foundation as well. Loose sump covers, dirt crawl spaces, cracks in the floor, openings around plumbing penetrations, gaps where the floor meets the wall, openings under stairs, in tubs in the bathroom. So all kinds of pathways, gaps, openings for air to come in. And with that, radon comes in as well. So technically, this is a type of radiation, and there is no safe level. We want our exposure to be as low as reasonably achievable, meaning without spending a lot of money. Back in the 1980s, we were able to get radon down to about 4 consistently. So the EPA established this action level of 4. Since then, we've been able to reduce radon in most cases to under 2. So the action level hasn't changed. It's still 4, but we have this unofficial recommendation of consider fixing your house between 2 and 3.9. Highly recommend it at or above 4. And the WHO has a guideline that's also similar to the EPA's. They say consider fixing houses and buildings when you're at 2.7. And internationally, they use different units. You know, we like to use different units in the US for whatever reason. Internationally, they use units called becquerels per meter cubed, and the WHO guideline is 100 becquerels per meter cubed. So as I mentioned, 2 in 5 homes are high in Minnesota, and Minnesota has very high levels compared to the rest of the country, or about 3 times the national indoor air average. So people often ask me, should I test? Or they might say, well, I don't need a test, do I? I heard if you're in an old home or a drafty home, it's not a problem. Or my neighbor tested and it was low, so I don't need to worry about it, right? Or I'm on this kind of soil or that, clay or sandy. Any kind of home can have a radon problem, new or old, regardless of the soil type. And we see a high radon across the entire state. Yes, it's a little worse in southern and western Minnesota, but it's still a big problem in northern and northeast Minnesota. And in this table, you see risk values at different radon concentrations. So EPA action level is 4, and that's kind of an average level in our Minnesota homes. If you've never smoked, your additional lung cancer risk of dying from radon is about 7 in 1,000. For smokers that are currently smoking, it's almost 10 times the rate, just from the radon. This is the risk from the radon, not the smoking. And then the general population kind of is a weighted average of those two groups. And the higher your radon exposure, the greater your risk of lung cancer or death. Now, the good news is we can test our homes. We can test homes over the course of a few days. There are these do-it-yourself test kits. There are professional devices you see at the top right. We can test over the course of a few months. We call this long-term testing. And if you're the homeowner of your own property or you rent your own home, you can get a test kit and do the testing yourself. Follow the instructions. You can get these kits for $12.95 through a lab called mn.radon.com. You can also check with your county health department. Some of those have test kits for free or a few dollars. Hardware stores do sell test kits, but they tend to cost a bit more than that. If you're testing when you're buying a house, you're testing a school or large commercial building, we do recommend using a licensed radon measurement professional. So when you test your home, test the lowest area in your home that you spend time in. It could be the basement or the next level. Remember to keep the windows and doors closed. Operate your HVAC, your furnace normally for the time of year. Do send that test kit in right away. Don't delay. And if the result is high, you could proceed to fixing the house right away, but you might consider a second test to confirm it. And then when you do those 2 tests, if the levels appear to be over 4, again, highly, highly recommend fixing the house. 2 to 3.9, you might still want to fix the house. Again, this is something where you're going to spend some money. Keep in mind, most contractors can get levels under 2. So it starts to make sense to fix it when you're over 2 and makes a lot of sense at over 4. And here you can see some social media images we've used. So if you've never tested before, we highly recommend you test now. If you tested in the past and it was low, you could wait 5 years and test again. But if something changes in the house with the heating and cooling, the foundation, you start spending time in your basement, you hadn't tested the basement, you build an addition, test sooner. Don't wait the 5 years to test. If you have a radon mitigation system, you should test about every two years or sooner if something changes. So if you do find high radon, what do you do about it? I would highly recommend leaving this to the professionals to fix. They'll do a better job than a homeowner that's more effective, durable, efficient. We have a list of these pros on our website. We have some guidance on how to find these people. Our website, as you see on every slide, is mn.gov/radon. So generally, a radon system looks like this. It's a pipe that starts under the house. Air moves up through that pipe. It's vented out. There's a fan in line, and that's what's pulling air out and stopping the radon from coming in. The piping can be on the side of the house. The fan can be on the side of the house. There are performance indicators. There's a pressure gauge called a U-tube. There's an alarm that will flash or beep if the system stops working. There's a lot of labeling that goes on the system. And by the way, we do inspect systems that have been installed recently. So it's a free service. You can contact us at the indoor air unit and request that inspection of a mitigation system you had put in your house. So here's some pictures of components of radon systems. You can see here the basement floor. They've drilled through it, put the pipe in, routed the piping up through the basement. It goes up through the house or the side of the house, discharges above the roof. There's a fan in line that pulls air out from under the house, and that stops the radon from coming in. Again, there's an alarm that they put on to tell you if the system stops working. Lots of labeling. You don't want the plumber or somebody coming along and mistaking that pipe for a plumbing pipe. There's a pressure gauge that shows you visually there's pipe moving, air moving up the pipe. And they'll also leave you a packet of information within instructions on how to test in the future, how the system works, just a lot of useful information for you. So one question that I saw that came in is like, what does MDH do about radon? Well, a big part of our work is to license and regulate the radon industry. So the folks that are testing for radon and the people that are fixing houses. So we license them, we make sure they're trained, they pass exams, we do continuing education to them, we inspect their work. If necessary, we issue enforcement actions if the work isn't up to standards. So that's our licensing and regulatory program. Then we have our education, outreach, and research program. We get a small federal grant. We buy test kits. We give out about 7,000 free kits to local partners who distribute them. We do awareness campaigns, TV, radio, web, social media. So you might see that this winter. We also research radon trends. We have different maps and studies you can find on our site. And we do a lot of community education, presentations, health fairs, and we help other agencies and organizations with policy efforts, like when people are drafting new policies or codes or laws, we work with them to provide data and technical assistance on those new policies. So in conclusion, the main point I'd like to leave you with are radon is a common health concern. It's a lung carcinogen. There's additional research being done to see if it might cause other health effects. Data currently and studies are limited as to whether other health effects like other cancers may be caused by radon. We'll see what comes out in the research in coming years. It is the leading cause of lung cancer in never smokers, second leading cause overall after smoking. Good news again is we can test our homes, we can hire licensed professionals to test, and we can hire licensed pros to fix. The action level is 4.0. You might consider fixing your house if it's close to 4. And do check our website for more information, including licensed pros, where you can find those and you can contact them to test a house, like when you're buying a house or to fix a house. And that is the end of my presentation. I'll turn it back to Amna.
Thank you so much, Dr. Begnaud and Dan, for your insightful presentations. It's clear from your talks how important it is to understand the risk factors for lung cancer, whether it's biological, behavior, or environmental. It's crucial for prevention and early detection. So thank you for your time. We've had a flood of questions coming through, and I've seen Dr. Begnaud, you've been answering them. So thank you for that. And we'll kind of spend some time on those questions as well, just since I know not everyone is able to see the questions that have been submitted so far. So I'm actually going to get our fire started. So we're actually going to have a virtual fire to reduce our risk, and then also, because it's not a fireside chat without getting our fire started. So just to kick things off there, submit your questions. This is now your opportunity to engage directly with Dr. Begnaud and Dan. So first question that I see here, and it looks like it's for you, Dr. Begnaud. Can smoking cause cancer anywhere else in the body, not just the lungs?
Yes, probably the other places are also in the aerodigestive tract, places where the smoke would get. So in the head and neck, nose and mouth and throat, and possibly even esophageal. The links to those are not quite as strong as for lung cancer, but certainly head and neck and mouth. Yeah. I am not equipped to answer these questions about 3,4 bins pyrene. I'm sorry. I don't know what to say about that.
All right. A general question that have been submitted that we think most of the attendees will be able to benefit from. So I saw here, just while your mic is off, Dr. Begnaud, is there an increased risk of cooking with gas stoves for lung cancer?
Let's see. So I answered a couple of questions about that, but I'm happy to talk about it. So, one person said, are you saying that cooking can cause lung cancer? And the short answer is yes. It's a little bit complicated. It relates to, how much you're cooking, what you're cooking, vegetables versus meat, what your fuel source is, if it's natural gas, if it's an open flame, if it's an electric stove, what the ventilation is like, what the setting is like, indoors or outdoors. But absolutely, there are studies really more in global and other parts of the country where wood fire stove cooking indoors is the typical type of food preparation method, and rates of lung disease and lung cancer in people who use that. So the short answer is yes. I said there, I think the safest thing to do, what I do in my home, is I have an electrical heat source for cooking. I always make sure that the ventilation system is running when I'm cooking in the home to try to get that stuff out of the house. And then there was another question about gas stoves particularly. So there's definitely some evidence that natural gas stoves might contribute to a variety of types of pollutants in home. And some of those are particularly harmful for people with asthma and might contribute to other health problems like cardiovascular disease and preterm birth and pregnant people. I think there's a small increase in lung cancer for that, but lung cancer is not the health condition that is most likely to be problematic with natural gas cooking.
Thank you for addressing those questions. And so Dan, this question is for you. And again, not everyone can actually see these questions. So I'm just gonna ask you some of the questions that have been submitted that I'm seeing that you're responding to. So there's a question asked about basement. So does a home without a basement mean that you don't have radon exposure or leaking into the home?
No, any home pretty much in Minnesota touches the soil, whether you have a basement or a grade or you have a crawl space. Air comes up through gaps and cracks and openings in the foundation, whether or not you have a basement.
All right, Dan, another question for you. Is it true that a split level with large homes is less likely to hold radon?
No, you really
No,
can't
sorry.
make such assumptions. You would have to test the house. It touches the soil, which is virtually every house or every home, not just single family homes.
Uh-oh.
Can you hear me now?
Oh, yeah, we can.
I seem to have
lost
cut
you.
out there for a second. Maybe I'll turn my video off.
Okay.
Yeah, so any home can have a radon problem, including multifamily homes.
All right. Dan, while we have you, there's another question that says, I recall that if you're testing radon in a specific county, they will require you to install. Is that correct? That the homeowner will need to install, do the
No,
mitigation
no.
themselves.
In the state of Minnesota, there's no city, county, state, or federal law that requires testing or requires mitigation. So I'd be curious to know more about this if the individual wants to contact me, because that would be news to me. I'm not aware of any city, county ordinances, state laws, federal laws. Sometimes lenders will have a policy that says, if I'm lending you money as a developer, as a contractual matter, I'm going to require you to test. That's a contractual matter as a condition of the loan.
So they clarify they're actually in Wisconsin, so
Okay.
good to know. Okay, there's another question quickly for you, Dan. So are apartment buildings and condos required to test?
No, again, there's no requirement to test schools or childcare, homes, apartments. We don't want to have laws that require testing at this time. There are efforts being made at the legislature to require testing in schools and childcare and rental, but none of those have become law. As of today, we'll see in the upcoming legislative session if any new radon laws are enacted.
Yeah, another question about that just came in, Dan, and I'm curious because this is an area I'm interested in too. I don't know if you can shed light on what you know about what's happening from a public policy perspective, or are there ways that citizens or people like me can contribute to those efforts, because I do think it's an important area that we're just turning a blind eye to.
Yeah, I mean, as individual citizens, you can talk to your legislators, you can voice your concerns. You can track actual bills if you really want to get into it. You can follow individual bills. You could even send in letters to committee members that are reviewing specific bills. You could even come in and testify when those bills are being heard in specific committees. You can write letters into the committees. You can meet with your legislators. You can get involved with the Cancer Alliance. That's a great organization in Minnesota that also tracks and supports various radon-related bills. So there are ways people can get involved individually and with their organizations or businesses.
All right, Dr. Begnaud, question for you. So we know that we've seen a rise in the risk of lung cancer is higher in women who have never smoked. What are the hypotheses out there in regards to the factors that's contributing to this?
Yeah, so there are a few. We're still trying to figure that out. One possible explanation is some of the things that we talked about today. So whether that's passive smoke exposure, whether that is cooking exposure. And so those are thought to be the case, but it's not, it doesn't seem like exposure to secondhand smoke or personal smoking or cooking explains it completely. So I had a few slides that I took out for time, but essentially, in the United States, the epidemiology of lung cancer has primarily been the epidemiology of smoking. And so that's changing now. And so men and women in the United States have hit their peaks of smoking at different times. And so for men, the curves of incidence in lung cancer are definitely on the decline. For women, they are not declining, they are stabilizing. And so maybe that means that we're seeing less cigarette smoking related lung cancer, and everything else that's still there is there because we haven't done anything to change it. We haven't identified what those risks are or haven't made any efforts to change them. There are some hypotheses that estrogen in some way plays a role in the biology of lung cancer. So it's really unclear at this time. I mean, it's recognized that amongst people who never smoked who get lung cancer, women are certainly more likely to be in that group of people. And there are a few things that we're talking about today that, women can do to reduce their risk. But it's not, there's still a lot of things to be sorted out there.
All right, so this is another question, Dr. Begnaud, I'll ask you about lung cancer screening. Are there any updates about the screening criteria and any efforts that can be taken by everyone on this call, the public, about momentum for policy and government level changes?
Well, the main direction of that is that, so there have been two very large, very expensive randomized controlled clinical trials, which have been done that show that screening benefits people who smoked for a long time. I think most of us in the field think that it's not going to be coming anytime soon that such a large study will be done in people who have never smoked to try to figure out if they would benefit from screening. I think what we're dealing with is a twofold problem here. One is that absolutely lung cancer happens in people who never smoked, but it is still a small part of people who get lung cancer. And so when you are trying to demonstrate that a screening test saves lives, you need many people, right? Hundreds of thousands of people to be studied, which is an expensive and difficult endeavor. And it also is a factor of the test. So the test that we're using right now is a CT scan of the chest, which is an imaging study that's easy to do. It's actually the most comfortable and the most easy screening test that's available, but it gives you radiation. You get radiation from the CT scan when you take it. So right now, for people who are not known to be at high risk for lung cancer, it just doesn't make sense. And we don't have any justifiable reason to start scanning people and giving them radiation, which itself can cause lung cancer. I think that when we have better tests available, we will be able to screen everybody. So maybe a blood test or a breath test, a test that doesn't administer radiation and doesn't have as many false positives, we will get to the point where we can start screening everybody for lung cancer and then only do additional testing on people who, might have lung cancer based on that initial screening test. There is a lot of interest in risk-based screening, which is where, the calculator, I put that in the chat as well for someone who missed it. But you know, for an individual person who has a high risk for lung cancer, whether it's family history or work exposure, secondhand smoke exposure, that those people might be able to be screened. The downside to that approach is that it's really hard for doctors and clinics right now to identify people who are eligible for screening just based on age and smoking history. And so trying to identify occupational history, family history, passive smoke exposure is a lot of difficult information to get from people. And so in practicality, the implementation of such a screening program that's risk-based would be even tougher than it is now. I mean, screening has been recommended for over 10 years, and we have still screened only less than 20% of people who are eligible to be screened. So about 17% of people who meet the current screening criteria have been screened, and we've been trying to do this for 10 years now.
All right, well, we have so many questions,
Yep.
so I'm so sorry, everyone, we're not gonna, we just don't have enough time to get through all of them. But go ahead, Dr. Begnaud, you're gonna say
if you, I
something.
mean, if you want me, I can try to type them in, or I mean, I can try to address them quickly, whatever you want to do.
Okay, I think just in the interest of time, let's just take one question for both of you, just one key takeaway that you want the audience to take from the conversation today.
Dan, you want to go first?
Yeah, the main takeaway is if you've never tested your home for radon, test your home. If it's been several years, test your home. If it's high, use a professional. A lot more information on our website about radon, including how to find professionals and test kits. And I'll work on answering these questions, at least in the Q&A feature here.
Thanks,
Yeah,
Dan.
I think my takeaway would be to advocate for yourselves. You know, this is a conversation that has really passionate and rational arguments on both sides. I work in advocacy spaces where I know lots of people who never smoked who get lung cancer, and so they're, you know, rightfully concerned and disappointed that screening criteria don't currently account for them. I think what I would say is that you need to advocate for yourself, and especially in the situation where you have unexplained respiratory symptoms, even if it seems mild, like a cough, and it hasn't gone away. A cough is not normal, and so you know, there are plenty of people, women, who are like, I've been telling doctors about this cough for years and they all always ignore it. So I would say advocate for yourself if you are seeing something in your body that you know doesn't seem right, to get the testing that you need to get a diagnosis.
So test your home, advocate for yourself. Those are the key messages that Dr. Begnaud and Dan want you to take from our conversation today. So unfortunately, we are out of time. So sorry we could not get through all of the questions that were submitted, but thank you everyone for just the engagement, the lively discussion. And special thank you to you, Dr. Begnaud and Dan, for your expertise and your dedication to lung health and helping us spread awareness about Lung Cancer Awareness Month, about lung cancer this month. So as we wrap up, we would greatly appreciate your feedback on today's fireside chat. When the session ends and when you close out of your Zoom window, a brief survey will pop up on your screen. So please provide us your feedback on today's session, because your input truly does help us improve our future offerings. And after completing the survey, there is a link to enter a drawing to win a prize pack filled with goodies from the Masonic Cancer Center as a small token of appreciation for your participation. And then the survey link, as well as both Dr. Begnaud and Dan's presentations, will be linked in the follow-up email that will be sent out tomorrow. And then I just want to mention side chat. So mark your calendars, is on December 11th at 1 p.m. and it's going to be on treating advanced cancers with engineered immune cells, featuring Dr. Brendan Mordiari. So he'll explore how genome engineering is shaping the future of cancer treatment. And lastly, make sure to follow the Cancer Center on all of our social media platforms to stay up to date on future announcements and events from the Office of Community Outreach and Engagement. So thank you everyone for joining us today, for your time, and we look forward to seeing you at future events. Have a good rest of your day and week.
Thank
Take
you.
care, everyone.
Thank you.